is really important. And then the second thing is kind of what people have said is practice, practice, practice. You want to get down to a fine art, almost to the point where you could.
We had more than 15 or 18.
For environment monitoring, the air sample grid which you use for sampling was non-sterile. Or it is in any labs. Air sample grid was non-sterile.
No, I mentioned, right? Consider it as sterile and it is case. Yeah. Okay.
Handling of air sample grid is allowed complete grid during sampling.
True. How is it to be done?
From the side.
Correct. Is
Shall
that
not break the first air.
correct? That's right.
Hand sanitization technique he followed was good.
Okay.
During personal monitoring, contact time given to the every individual sample was less.
There was no contact. It was just contact at a point. It was, I know. Do you all follow rolling technique so that to make sure the entire surface is touched? He was just touching uneven surface at one point. He took sample from like very small area, not 25 centimeters square. That's not acceptable.
Right.
Yeah.
While doing finger dabs,
Yes.
only tips of fingers were touched to the.
Barely. Even the entire tip was not touched. You have to follow the rolling technique for finger dabs.
He'll add 2 more.
So what do you monitor, tips or the dabs over here?
Both you have to do.
Why?
Because this is the most contact surfaces. You can do the technique like that. You keep like that, then you lift like that.
Okay.
You keep like that, and again you lift like that. So both you can sample. This is the part, it is going to have more activity with the sterility. If you want to touch if you want to hold your forceps, you are going to touch like that. If you want to hold any sterile article, you are going to touch with this file. This is the most, we are going to use in the sterile area. That's the reason we have to pad as well as stick, both we need to sample.
Okay.
And you should have it because it will sustain.
Correct.
And
He was, I think, trying to be in the camera view. Okay, but that is definitely not acceptable. Also, he was sanitizing his hands very close to the air sampler, which is not acceptable.
And the lid placing, while removing as well as placing, both the time he has to keep, he has to hold side, and also while keeping the plate, it is not required to keep on the floor the lid actually. Just he lift the lid, he can keep the plate immediately.
That's right.
Instead of keeping on the floor.
Correct. And the lid of the plate is.
It should be face up. Like, it
Face
should
up?
be down. It should be down.
Yeah. And what did he do? And what do everybody does face down, right? Yeah. Okay. Yes? Mic over there.
So he was leaning over the plate during the exposure.
Yes.
That was one thing.
That's not right.
And the other thing was he forgot to monitor his chest and feet during personal monitoring.
Chest he did. Maybe with his back. Yeah. Chest he did. Feet he did not do. Yeah.
And I observed that the plates were still having 2 wraps. So if that's the case, then the material movement did not occur properly.
Good observation. And no sanitization of the wraps prior to opening. Yes. And is feet required to be monitored for regular
Not
exit for every exit?
As part of governing qualification, they monitor.
Qualification. Okay. Yes. Any other observations? Any other flaws?
Madam, he has not sanitized this sieve after keeping that sieve on the floor. Then he kept directly on the.
Yeah, that's wrong. You should not keep it down in the first place. You will.
Then after that, he has not taken any empty cycle before starting the air sampling.
Do you all do that for every sampling?
Yes.
Okay, fine. So that I think is each organization call. It's not a mandatory requirement.
Delay time should be there.
Delay also, yes, it should be there. I mean, Yeah, that's right. Delay should be there. At least he should come out and away from the sampler. Yeah.
He has not done labeling also on the plate.
Good point. Yes, even I noticed that. No labeling. I don't know how he's going to decide which one is what.
He has not documented the.
Wait, let him finish.
He has not also documented the air sampling time.
Yeah, no documentation. I don't know what he's going to do with the results. Okay. Yes.
After blood finger gas, we have to sanitize hand. Sanitize hand.
After glove finger dab, yeah, he didn't do, and he did just before sampling, which is not acceptable.
The loading technique for
And nobody mentioned that, right? He sanitized just when the person was about to open the plate, he quickly sanitized his hand. Is that okay? No. That's definitely not okay.
no plate labeling.
No plate labeling, yeah, that's covered. Any other observations from the moderators? And if you all can help us categorize as critical, what is critical?
So that participants should categorize that. When you identify the mistakes and those mistakes, you must know what is absolute no and what is kind of acceptable.
Correct.
So this exercise particularly, everyone here is involved in the manufacturing of sterile products, so they know how important this is. This looks to be, kind of simple activity, just donning the clean room garments. But you can imagine for an operator who enters the aseptic processing area 3 to 4 times in a day, and for those operators it becomes, kind of very mundane, monotonous, kind of activity and so on. So perhaps they would tend to do mistakes. And the bigger point which I would like to bring here is these are all sources of contamination.
Exactly.
Which can eventually enter into your sterile port and may find a way to contaminate your product.
And you may not detect it. Our environment monitoring cannot detect 100% contamination. So our practices have to be right.
Absolutely.
Yeah.
So the point is these are very contradictory points. Important practices, but they become very boring over a period of time. So that's why, and it's really difficult to maintain that level of motivation to always do good and so on. So it's more upon the motivation and self, I would say, discipline to bring. And what Tim said, that practice until it becomes your behavior.
Yeah, practice with awareness. What is going wrong, where it is going wrong, and how it can contaminate the process, the product, and ultimately risk to patient. So without that awareness, how many ever times we do it, we may not get it right. So that awareness is very important. Tim, any words from you, additional comments on sampling? Anything we missed?
No, I think that's really good. The only thing on sampling I would say is that, particularly when we're looking at aseptic processing, is to really understand the process and the main risk points where the operator is interacting with the aseptic environment, and to make sure that we're really focusing on those parts of the gown that might ever ingress into the grade A environment.
Yeah, thanks, Tim. Yeah. Anything else? Anybody else, any other comments? Or I think we can end the session. Good interaction from all the participants here, and I hope everybody has had good understanding and good discussion.
I just have a comment.
Yeah.
I think we'll have to give big round of applause for these two gentlemen. Job at this side is easy, but job at that side is very difficult, and I think we'll have to work very closely with them to make sure that they understand and take it together forward. Thank you.
Mr. Rahul Mule
That, Ravi,
and Mr. Satish Rajmani.
these are the people who stand between your facility approval, right? So that's why keeping them motivated is always, very important. And so that they keep performing the same regular Monday doing job with perfection always. So big round of applause again.
For Mr. Rahul Mule and Mr. Satish Rajmani. Thank you so much. And thank you to our panelists. Big round of applause for our panelists, please. Alright, with that, we'll speak to Tim now.